Hello nurses, I'm here to talk about a care plan for impaired verbal communication. And before we get started, I just want to remind you, let me pull back my camera and then I'll probably have to focus. I want to remind you that this care plan is written just like the nursing process. Okay, so you do all your assessing and then you do your diagnosing, your planning, that's what your outcome and goals are for, your interventions, and your evaluations. So you have that ADPI right within your nursing care plan. Okay, so we're going to have our patient is having some impaired verbal communication related to aphasia, expressive aphasia. And so maybe our patient had some type of stroke or brain injury, and we may see this when we are in the clinical area, a patient with expressive aphasia. So impaired verbal communication would be the diagnosis, and when you look this up in your nursing diagnosis manual, you're going to add the page number where you found that. So our patient, let's say our patient had a stroke, which is an injury to the brain. So related to the brain injury, supporting data as evidenced by slurred, sputtering speech, or inability, difficulty speaking. And so we have our PES statement all here in the diagnosis. So next we're going to move to our planning. And what I want for my patient is that they'll have the ability to communicate in a way that they can be understood and to get his or her needs met before discharge. So we're going to want the patient to be able to express him or herself by using assistive devices, that the patient will demonstrate correct use of those assistive devices, and the patient will communicate successfully with family before he or she is discharged. So I just want to talk about what do we mean by assistive devices. So when you're a nurse, we already know that assistive devices for communication might be a whiteboard, they might be pictures that the patient can point to, or frequently used words that the patient can point to, things like that. And when we are nurses, we already know what those assistive devices are, and so we don't need to spell them out in the care plan. So we can just use that term of assistive devices. Okay, so we have our goals. And remember, our interventions all have to get us to what these goals are. So let me keep both of those in the frame. So we're going to assess the ability of the patient to understand pictures and written words. Oftentimes, aphasia is only expressive. They can understand, but they cannot express themselves. But we just want to make sure that they can understand the pictures and words. We are going to place important objects within reach so that the patient can either point to them or reach them. We're going to teach the patient how to use assistive devices, and that can take some practice, and the patient may get frustrated. So there is quite a bit of teaching involved there. We are going to collaboratively work with the speech and language pathologist, so that's the SLP. And we're also going to teach the family how to correctly use those assistive devices. And remembering that when we have these devices, we also need to keep these within reach of the patient as well, because if the patient can't reach them, they're not going to do any good. So all of our interventions get us to these over here. And then again at the end, we're going to do our evaluation, and we're going to evaluate each goal that we have. So we are going to say the patient met the overall goals and outcomes, that the patient is able to express him or herself using the devices, they correctly use those, and they also are able to successfully communicate with their family members before discharge. So that is a care plan for expressive aphasia for a patient with impaired verbal communication.